Well, I began, when I went to college to go to medical school, I began working in a hospital and in the emergency room, and got exposed to orthopedics during college. And then when I went to medical school, I liked it a lot. It's the opportunity to help people who've been injured or have problems. You can get back to their life and doing things that they enjoy to do again. I'm a local. I grew up an hour from here and been in Joplin for 20 years now. Actually, 30 years now. This is where I grew up, and it's home. My family's all here, and it's just always home. I get my most pleasure in seeing people back in the office that I've taken care of. That's probably the most rewarding thing that I do, when people come back after having a joint replacement surgery and they're back doing things they couldn't do before. And that is what I love about my job. That's why I do what I do, because of the pleasure I get from seeing people get back to their life. We as physicians at Freeman want to be more involved with our patients. We all see our patients and evaluate them and work them up. They don't get seen by an extender or a nurse practitioner or a PA and see the doctor at the day of surgery. I mean, I see all my patients in the office, and we have all discussions, and they know well before they get there who I am and know who I am, basically. And I think that's very important to people. And the same with after surgery. A lot of physicians don't see their patients after surgery for 3 months, and I enjoy that. That's my favorite part of what I do. I want to see my people at 2 weeks and at 4 weeks, and hopefully they're smiling and happy and getting better, and that makes my day. And so that's a big thing that people don't get other places. And they want to see me. They want to see a nurse or something. They want to see the guy who did whatever they did to him. And so I think that's very important in people getting better too, is they want to talk to me, and that's fine. I want to talk to them as well. So that's and then our education program is much better. I've been blessed to have that we actually were doing that before it was really popular. It's very popular now, but it wasn't 20 years ago when we started it, and we've got a lot of experience with that, and patients love the preoperative class. They learn a lot of things that really helps them for when they go home. And now we're doing the iovera injections for people for total knees, which helps a lot with their post-operative pain, and that's been a good thing as well. And not only the iovera, but just we do what is the state of the art for joint replacement, whether from pain management to rehab to whatever else. We stay on top of what is happening, and we do what is the best thing that the literature shows at the moment to make people better. We really we try to have a luncheon for our patients to come back, and a little thanks for coming to see us, and it's good to see them and get back to activities. And you get to know these people. You see them for a lot of years, and they become a part of who you are. You know their family, you know who they are, and that makes it more enjoyable. And they enjoy it, and I enjoy it. Our staff enjoys it. This takes a team of people. It's not just about the doctor, but we have a tremendous preoperative class that really helps people get ready for surgery, that's been around longer than any place else in the area. They're very experienced. They do a great job of educating people before they come to surgery. We have a great operating room crew and a super staff of nurses on the floor, physical therapists. It takes all these people to get the results that we get. It's not just about what I do, but without all the people who help me do what I do, it wouldn't be possible. And we're blessed to have such a great team of people throughout the health system that provides the care they do. We try to take care of our patients like we want our family taken care of. That's basically what it comes down to. You want people treated well, you want things to go smooth, you want them to have a good experience, you want them to get a good outcome and get a good result, for them to be happy when they're done and glad they went through what they went through. And that's really the most important thing, is just treating people like treat people and trying to get them back to doing what they love. And that's what I try to do every day. If a patient likes you and they know you're doing your best effort to make them better, they try to get better. I mean, they want to succeed for me just as much as I want them to be good for themselves. And so well, I have a great relationship with my patients for the most part, I think, and I enjoy them. I think we have a good time when we talk in the office and do things, and I think that's a very important part of what I do, is that I want people to be comfortable talking to me, telling me what's wrong, what's going on, what issues they have, and feel like I try to listen to them and try to address whatever problem that they're having. Sometimes it's orthopedics and sometimes it's many other things, but we try to take care of people and treat them like I would want to be treated if I was on the other side. If you really listen to people and study them and talk to them and spend time listening to what they have to say and examining them and try to spend a good amount of time explaining to them the problems that they have, and that tends to put people at ease. I mean, sure, everybody's nervous, particularly if they've got a bad joint, and obviously they're coming to see me because they may need an operation, and I would be scared if I was going to have a knee operation or hip operation. That's normal human nature, and you just try to, explain to them the best you can what they have, what's going to happen, what they should expect to happen throughout the way, and then people do better when they have a good basis of what's going to happen down the road. That's their biggest fear of how much pain am I going to have, how long am I going to be off work, and you try to give people a realistic expectation, not just tell them something so they feel really good, but you got to be honest and tell them, this is a 3-month ordeal and it's going to take time and you're going to hurt and you will get better, but you just, people are fine with that once you explain that to them. So it's just really about spending time with people and trying to listen. The best thing we have is just what I said earlier. I mean, it's just, we have a great system of how we do things. I mean, we're really, from every part of the hospital, from the pre-op, the nurses, the therapists, the operating room, and we're pretty blessed to have what we have. Our results are very, very good. We have an excellent team of physicians as well that are all very well trained throughout all different aspects of orthopedics, and we offer a lot of really state-of-the-art care. You really can't go really anywhere that, for the most part, that's not something that can't be done here. There's always a few things, but some things shouldn't be done here, and that's appropriate too. But for the most part, you're not going to find really better orthopedic care anywhere else in Freeman right now.